I'm Bill Snyder. I'm joined by my friend Dr. Peter Spiers from Southern Inyo Healthcare District, the CEO.
Yes.
And they have accomplished over the last few years the miracle on Locust Street, brought Southern Inyo Hospital from the brink of the very precipice of going out of business to successful business, expanding, doing all kinds of great things. Don't want to get too far into it, but Peter, welcome. It's my pleasure and my honor to have you here. And so what's happening new since you've been here last in Lone Pine in the Southern Inyo Healthcare District?
Yes. It's always great to be with you, Bill.
Thank you, Peter.
Lots of stuff. I probably need 2 hours to tell you all about it.
Okay.
But I'll tell you the most important thing, and that is that our staff and the capabilities of our staff are phenomenal. In the past, the hospital had some really good clinicians and some really good administrative staff, and then areas that were needing help. I can promise you now that whatever department you go to, you're going to have competent, helpful, service-oriented people. That's been the biggest accomplishment internally for the hospital. Operationally, we now act and behave like a real hospital. And that's been a problem for us for many, many years down there. It's been inconsistent, they've been closed, they've been open, and the perception in the community was, I don't want to go there. They don't seem like they have their act together. And the things that I hear now, and we do a lot of surveying, is that that's not the sentiment anymore. That, in fact, they feel comfortable, they want to be there, and they're getting great health care.
And you did a customer satisfaction survey.
We did. We do them all the time. We do them internally within our own staff, and then people who come and visit us in various constituencies. And the last one we just did was for our emergency department. And that's a tough one because people who come to the emergency department are usually in trouble.
You're seeing people at their worst.
They're at their worst. And we had an over 85% family satisfaction survey. And then the patients who could give us the survey, it was even higher. It was almost 90%. So, and that data is available because we have to submit it to the state of California.
Those stats are very impressive. And so you've gone from, I have friends without naming names in the area, Lone Pine, Olancha, and so on. And they've told me over the years, over the decades, I guess I'm going to have to go to Ridgecrest.
I know.
Because I've got something going on. And now they not only feel comfortable going to the Southern Inyo Hospital, but go there and go, oh my gosh, this is fantastic. And I've said this when you're not listening, when you're not sitting next to me, because this is what they've told me and had no idea that I would relay this onto you.
Yes.
So we can't really name names.
Of course.
Just out of, I'm not covered under HIPAA laws, but as friends, they don't need that. But almost inconceivable 5 years ago.
It is, like you said, the miracle on Locust Street. And
I got that from you.
And I got it from Jackie Hickman, who's one of our board members.
Love
She
Jackie.
came up with that motto. And that's the most meaningful to me as the chief executive officer, is that people, that we care for, we're there to serve the community, say these things. That's more affirming. I can do surveys and I can do things that prove things and I can play with the numbers. When I went to college, I had a statistics professor that says, figures don't lie, but liars can figure. So you have to be skewed a little bit when you look at any data. But when it's people to people and someone like a Bill Snyder and they come to Bill, that means a lot to me. Some people would say that's anecdotal. No, I said that's, for me, more real because they've been there, they've had an experience, and they're telling you how they felt when they left. Good stuff.
All right. And I imagine that you're getting more people through using your services than before, and you're not really spending $100,000 a month advertising.
We are not. We have a very small, very skinny budget for that. We use a lot of the free stuff that's out there, like social media and things like that. So no, we don't have a big budget. We do get data back, though, from our radio spots on your station. And there people always say, I heard you on, it's KSR now, or what is it? What is it? Alt 90, which one is it? But anyway,
right.
And they say that. And so that's helpful to me as well. And people have showed up when I've said we're doing this or that, and they said they heard the radio ad. So that's confirmatory for me. So
excellent.
Yeah.
But it sounds like the best advertising is word of mouth advertising. and it's positive.
For our marketplace, it's huge, and we're excited because there's something on the horizon for us that we think we're going to be able to do in terms of a mobile clinic and hit the outer lands, the hinterlands of our district. It's a 100 square mile district.
So you're not only in Lone Pine, you're taking care of Tacopa and Shoshone.
And Death Valley, and even down to Pearsonville is in my district.
Oh, okay. I hadn't thought about Pearsonville.
A lot of dirt, a lot of sand between me and Lone Pine.
Yes. And a lot of accidents happening
All
at
over
Pearsonville and through
all
there.
over the place. And they do come to us. Most of the time they'll go to Ridgecrest, little different levels of care there and a little bit more tertiary. They can do some things we can't do. But we get a lot from all over the place.
Well, very good. So we're going to wrap this up. Dr. Peter Spiers, Southern Inyo Hospital, and we'll have more coming soon.